Firstly, I was always interested in the area of social development. While my peers from Oxford were getting into investment banking, I wanted to come back to India and be involved in some area of development. It's with life's journey, I figured out that I'm passionate about healthcare. My mother felt very seriously ill, and we did a round of a lot of hospitals. And we realized that we do have some of the best doctors in this country in terms of experience and competence, but the services of the hospitals can be improved. Patients and attendants, when they go to hospitals, they are already very distressed. Then for getting simple tasks done, they have to run pillar to post, and these can be made so much easier. We have good systems and processes, and that's why I got into hospital management. My husband, in fact, has founded this NGO, and every important decision we take together. Yes, this is first of its kind in the sense that it is a free service. So we have no commercial transaction, as I just mentioned, between doctors and hospitals, and we don't charge our members. There are other commercial entities, but we stand for a social cause, and because we stand for a social cause, we have found many doctors who are helping us, and completely on goodwill. In fact, we have doctors sitting in rural areas with limited internet connectivity helping us answer our queries. And many people who have been helped by our NGO, they have come forward and they want to help us, be it from IT background, be it from banking background. So honestly, it has not been difficult to find people, like-minded people who want to come and help us purely on goodwill. After having worked in hospitals, it gave me a good insight on how healthcare works, and that's when after a few years, my husband Manu Tripathi and I decided that if we start our own NGO, we can have a larger impact in terms of making a difference in healthcare. Because what we found was that there is predominance of super specialities in urban cities, and the whole concept of a family physician seems to be dwindling. We currently are focusing in Delhi, Bangalore, Mumbai, and we also help people in Assam. But if we get requests from other cities, we don't outrightly turn it down. We see if we can help them. Getting healthcare is a right of every citizen. In fact, in 1995, the Supreme Court held that right to healthcare is a fundamental right which is covered under Article 21, which is right to life and personal liberty. Now, I'm going to answer your question a little differently. I'm going to talk in terms of not middle class and lower middle class, but urban-rural divide. So, 70% of our population in India is in rural areas, and about only 26% doctors are present in rural areas. So, the problem is not just about affordability, but it is about accessibility. And it is quite paradoxical that India is emerging as a hub for medical tourism, and we can't even give healthcare to our own people. Yes, we do have plans to be part of addressing this problem, and technology is going to play a very major role in the form of telemedicine. If we can't take doctors to rural areas, then we can connect the people in the rural areas through technology, which is telemedicine. Now, technology is so advanced, telemedicine is so advanced that a doctor sitting in urban area can actually get a live ECG report. We can also have other equipments like a fetal Doppler, spirometer connected to this technology. So if we have this kind of facility, then patients get timely diagnosis, treatment, and possibly save lives. Actually, everything is a business now. And making money is not, it's not incorrect. People, hospitals do need to make money if they have to maintain their infrastructure, have to pay doctors. It's a very expensive affair. But making money unethically, that's where the problem is, because we are dealing with human lives here. We are not dealing with products. Having said that, there are many doctors in private practice that are doing outstanding jobs, and some of them are also supporting this cause. There are many doctors that we don't know of are quietly doing social work, and we plan to have rewards and recognition programs for these doctors. In our own way, we are contributing by guiding people, and it's an absolutely free service. Critics might say that this is not sustainable since we are not making money, but we do have plans of raising funds, and there are enough funds to tap into for a good social cause. We are an NGO which is not just a trust or a society, but a company under Section 25 for charitable purposes. So this is the most credible form of an NGO, and this is licensed by the Government of India. We have to be transparent and accountable, and we are bound by company laws. So this gives us a very strong foundation to represent the social cause. When a layman has a problem, she does not know which kind of doctor to go to, because there are so many super specialities that are proliferating by the day. And even within those specialities, doctors are further specializing. So an orthopedic doctor, there would be an orthopedic doctor who only specializes in the knee aspect of the body. There would be an orthopedic who only specializes in replacement surgery. Then there would be an orthopedic who's only concentrating on the spine area. So there are so many super specialities. So that's when we found that there is a dire need to have a guide to be able to guide people correctly to the right kind of speciality. We have two aspects to this NGO. One is we have a citizen journals forum for which we've used Facebook as a platform. We have more than 29,000 members currently on that forum, and that forum is used for interaction between doctors and members on various healthcare issues, be it stem cells, be it generic drugs versus branded drugs, be it medical negligence. And this platform, since the members are not face to face with the doctors, it's a less intimidating platform for patients and members to be candid about their opinions, and it gives an honest perspective to the doctors. We also encourage people to share their experiences, good or bad, in healthcare, so that others can learn from it on this platform. And we take suggestions from people as well on various healthcare providers. The other aspect to our NGO is when people have personal health problems, we encourage them to send us a query through our website, hospitalguide.in. There's a simple form that they need to fill out, and that information is kept confidential. It comes into our mailbox. The first thing that we do is we call up the patient or the attendant after we get the query, because human touch is very important when it comes to healthcare, because it's such a sensitive matter. And also, most of the time we find that the information that is given to us is not complete and accurate. So let me give you an example. If somebody has sent us a query saying that they have a stomachache and they want some guidance, after speaking to them, we figured out that they had a hernia operation 2 months ago. Now that information is very relevant for us to guide them correctly. So after we have got all the relevant information, then we run it through our core group of doctors and figure out which kind of specialists they need to go to, because sometimes it's even difficult for doctors to figure out because there's so much overlap of specialities. And then we suggest, so after we figured out which kind of specialist this patient needs to go to, we then suggest doctors from our database. So our database is a hand-picked database of doctors on whom we've done a reference check. The important thing here is that we are a free service now. So we are not just free for members, but we are absolutely free, and there is no commercial transaction between doctors and hospitals. So the suggestions that we are giving are completely unbiased. The last step to the whole process is feedback. This is a very important part of our engine, because it is through feedback that we are able to further refine our database of doctors.